We know that lower back pain can happen for so many reasons. There are countless reasons why, because there's so much that comes into the lower back in terms of the relationship of the lumbar vertebra, the lower vertebra, with the two sides of our pelvis, with the legs as well. So there's lots of kinds of movement and articulation that goes on for different tendons or ligaments or fascia to be pulled in ways in which those joints can't work optimally. So this technique is really a restorative care technique. It's a technique that helps the lower back find kind of a ground zero and a foundational place to remember, like, oh, all right, this is where I can settle. It may not cure your back pain, depending on what's going on, but it absolutely can be an asset for helping your back stay as versatile and mobilizing in terms of its relationship to all of those parts. So this is one I use a lot when I get a little tweak in my back, and sometimes it helps to reset all of those joints and ligaments and tendons and muscles to calm them down a bit. And I may still need to be doing other strengthening things or have other outside support to help get that alignment back in a balanced way. But try this exercise out. I'm using some bolsters today, but you could use a couch or a chair or an ottoman or anything that gives you a 90-degree angle of your hips and your knees to come into what I call a tabletop position. So really be clear about how to find what structures you need to get the position correct. So I'm going to come down and show you what I mean. So here is my tabletop position of my knees right over my hips. And if you like, if it feels good, you can take your knees out to the side. If it feels better for your knees to be right over your hips, that's okay too. The first thing I like to do here is to place my hands on my lower belly, because sometimes the organs can get pulled in certain ways, and to help them feel their density, their weightedness, it's nice to have a little bit of weight on your lower belly if it feels good. Sometimes I use a little eye pillow for a little bit of weight, or something that like a little rice bag to give my organs just that little bit of feedback to begin to settle towards the back of my spine. So in this position, you can feel the weight of these femur bones, these thigh bones, trying to drop a little bit more into the sockets of your pelvis here, into your hips. So that allows all of the muscles around the hips to begin to soften. And be a little picky here. Maybe you want to scooch your body over to one side because maybe there's a psoas contracture over here, which is a muscle that runs from your lower back to your upper inner thigh. And when that muscle is very tight, it can pull our back out of alignment as well. Maybe you need a pillow, a little pillow supporting your head. So try out different positions, but the main idea is that you have your knees right over your hips. And then simply take some nice, deep, diaphragmatic breaths or belly breaths here. Allowing the weight of your body to sink back towards the floor. This is best if you can do it on a carpeted surface or with a mat, less effective in your bed. So we want a little bit of support, but we want it to be a little firm so that our spine, our lower back, those femurs can really feel the ground lifting up to meet that support. And then simply rest here for as long as it feels good. Sometimes people fall asleep here. That's great. If you have only 5 minutes, 5 minutes is good. Maybe 10 or 15 is better. If this position doesn't feel good for any reason, another one to try is simply rolling onto your side in a bit of a fetal position. So simply bringing your knees up as high as it feels comfortable. So you're again relaxing the lower organs, you're softening in the hips. You may even want a pillow between your knees or your ankles to keep that knee and hip in alignment. Explore for yourself, take some deep breaths here, and see if you can begin to sense the body starting to calm. So that nervous system is starting to drop into our parasympathetic side to be able to have the protective muscles that want to hold begin to soften. And hopefully that helps support your path towards greater ease and mobility and less pain in your back. Thanks for joining me today.